Doris Byers. I'm an RT student, and I'm here to demonstrate how you do trach care. The first thing I do is I come into the room, I knock on the door, I make sure I look at the patient bracelet, make sure the identification matches the one that I have on the chart when the physician has written if the patient needs trach care. I make sure that I have my equipment ready here and my trach care kit. And what I'm going to do next is I'm going to go ahead and wash my hands. I'm going to go ahead and put my gloves on. Before I start doing anything, what I want to do is I want to go ahead and check the patient. I want to go ahead and check patient's vitals, heart rate, pulse, and bilateral breath sounds. The patient right now doesn't have any coarse crackles, so normally if he does, you would suction, but right now he doesn't need any suction. So I'm going to go ahead and put this drape on the patient, and what this does is it prevents, in case he coughs up any sputum, prevents any sputum from getting on his body. And for myself, I have this protective gown in case anything spills over. Next thing I'm going to do is I'm going to go ahead and place my sterile gloves here, and then there's the sterile drape, which you got to make sure I don't touch the sides, the insides of it. And I'm going to go ahead and set it up here, just like that. Alright, so dump this in here. And I'm going to go ahead and get hydrogen peroxide. And I'm going to put half of the hydrogen peroxide here and dispose of it. I'm going to get some water, saline, and I'm going to put half of the water here. So as I have a solution of 50-50 hydrogen peroxide to water, then the rest of the one's going to go in these two containers right here. I dispose of that too. And I'm going to go ahead and take the patient's, I'm going to go ahead and put my sterile gloves on. So, I'm going to go ahead and remove the old dressing. I'm going to dispose of it. Then I'm going to go ahead and get a cotton swab. First, I'm going to go ahead and remove the inner cannula and go ahead and drop it in the hydrogen peroxide and water mixture. While that's happening, I'm going to go ahead and put some hydrogen peroxide and water mixture here and go ahead and clean the trach area, making sure that I can also go ahead and press down on the skin where to prevent some of the infection that could happen. And I'm going to dispose of that. I'm going to go ahead and also use another cotton swab to dip it in water, in saline, so that I can go over the skin. So because the hydrogen peroxide tends to irritate the patient. Go ahead and dispose of that. And what I'm going to do next is I'm going to go ahead and clean the inner cannula, making sure I scrub the insides of it, making sure I scrub the outsides, and I'm going to go ahead and put it in, dip it in water, in sterile saline, and I'm going to go here and just make sure that it dries. So the next thing I'm going to do is I'm going to go ahead and change the patient's dressing. And I'm going to change the securing device on it.
We're supposed to do that one, get you ready inside the process?
Yeah, no. Which one did you say? Yeah, once I say patient accepted OPA.
Oh, really?
This is the time. No.
make sure that I can at least put 2 fingers in so that it doesn't strain the patient's neck. I'm going to go ahead and dispose of this. And by this time, our inner cannula should be dry enough. So I'm going to go ahead and insert it in. I'm going to make sure it clicks so that it's locked in place. At this time, I'm going to go ahead and dispose of all this. And I'm going to reassess the vitals. The patient has tolerated the procedure well. Again, I'm going to go ahead and throw all this away. I'm going to go ahead and take off my gloves and PPE, and I'm going to go and ask the patient if there's anything else I can do for the patient, make sure they're right, and I'm going to go ahead down and chart everything I did, and all of the orders were fulfilled. Thank you.